Good morning. I'm Paige Winfield Cunningham, and I cover health policy and politics for the Post. And this morning, I'm very pleased to welcome two members of the Senate Committee on Health, Education, Labor, and Pensions to talk about the latest healthcare efforts on Capitol Hill. So thanks for being here. First, to my left, we have Senator Bill Cassidy, a Republican from Louisiana. He's also a medical doctor by profession. In September, he and Lindsey Graham headed up the latest effort in the Senate to repeal and replace the Affordable Care Act. Senator, I hear you and your daughter recently adopted a puppy. I have two questions. First question is, what is the puppy's name?
Coco, and I prefer to be C-E-A-U-X for Louisiana, but got outvoted by my daughter who doesn't like to spell long words.
And does Coco support the Graham Cassidy bill?
Oh, absolutely, because Coco is all about having power for the dog.
And we also have Senator Chris Murphy here, a Democrat from Connecticut. Before he was elected to the Senate in 2012, he served 3 terms in the House. Senator, during August recess, I hear you walked 100 miles from one end of Connecticut to the other, but I want to know, would you walk 500 miles?
500 miles, 500 miles. Yeah, walking across the state of Connecticut is a great idea in theory.
Now,
when you do it, it's a little different.
Asics or New Balance?
Nikes. Nikes, the same pair. I did it last year. I did it again this year, and I just wore the same pair of shoes every day and survived both years.
Well, good choice. Let's begin with the ACA marketplaces, which, as you both know, opened for the 5th enrollment season in just a week. Your respective parties could hardly be more divided over health care, but let's discuss something you do agree on at the moment, which is that you both backed the bipartisan bill from Senators Alexander and Murray to stabilize the marketplaces by providing cost-sharing reductions, which we all know as CSRs, and giving states more waiver flexibility. Senator Cassidy, how important is it for Congress to fund these CSRs? And then more broadly, since Republicans have so far been unable to follow through on their repeal-replace promises, do you feel like the party has a responsibility to improve the marketplaces as they now stand?
Well, first, the importance. Long term, there needs to be something done about the exchanges. Both parties agree to that. These parties have different solutions. Single payer versus Graham Cassidy as an example. Medicare essentially for some, perhaps for all, and Graham Cassidy. So we need to do something though in the immediate. You think about that working family sitting around the dinner table, their premiums will rise. Already they've gone up since the Affordable Care Act started. In my state, there's a couple paying $40,000 to $50,000 a year for their insurance. I was fact-checked by Glenn Kessler. He goes, yeah, that's true. At $40,000 to $50,000, think about that. So you want to at least mitigate that. We won't completely eliminate it, but at least mitigate it. CSR can do that. In Murray Alexander, or Alexander Murray, there's also some things for the state that gives them flexibility to actually begin to lower the cost of insurance. That is so important. We've got to do that. As regards an obligation, I don't think about my party having an obligation to the exchange. I think about me and my party and all of us having an obligation to that family sitting around the table, who over the last 8 years have seen their premiums skyrocket after being told their premiums would decrease by $2,500 a year. They feel cheated, and we need to do something about that.
You all met with President Trump yesterday. Did you get any more clarity on when you might vote on a plan?
On what?
On a CSR?
No, I think there's still some negotiation. Clearly, the House still has some reservations, and the President does too. I think they would like to do away with the individual mandate and a couple other ththings. And so I think that has to play out a little bit.
Senator Murphy, I wanted to ask you to respond to some elements that you probably saw yesterday. Hatch introduced his own CSR plan, which would go in a more conservative direction by suspending the individual and employer mandates. Can you give me thoughts on that? I mean, there has been a lot of talk about how the individual mandate, at least, didn't work quite as well in encouraging people to get coverage as many had formerly thought. And then, of course, many employers previously offered coverage before the Affordable Care Act. Is that something your party could accept, or is that a non-starter for you guys?
You know, I haven't taken a look at the Hatch-Brady bill in detail, but it looks to me a lot like the skinny repeal bill that didn't pass the Senate when it was first offered and would likely result in millions of people losing coverage. We have 60 votes for Alexander Murray in the Senate right now. I don't see why we don't put that bill on the floor and do something to stabilize the markets, take the keys away from President Trump in his campaign to try to sabotage and undermine the marketplaces, and find the sweet spot on the issue of flexibility, which is something that Republicans have driven, but a lot of Democrats agree with. I worry that, you know, if you put into this a conversation about getting rid of the individual mandate, we'll be right back in the same partisan conversation that we have been for the first 8 months. This is a rare opportunity to find some common ground, and given the fact that we have enough votes in the Senate right now to overcome a filibuster, let's do it.
Can I say a couple things? One, I'm going to disagree a little bit, because even if we passed it in the Senate, we would not pass it in the House, and the president would not sign. An exercise right now in futility, it seems better to kind of continue working through. But I'll tell you one of my beefs about the Affordable Care Act. Jonathan Gruber, the Jonathan Gruber, who architect of the ACA, wrote an article which was published, a summary of it in the New England Journal of Medicine, and he said the individual mandate had no statistically significant effect upon increasing enrollment. Now this is Gruber, who is the architect of the ACA. Individual mandate, no significant effect. Now, but it's become this inertia of Washington, that Washington has to control the life of that family sitting around the table, so they're going to reach down there and squeeze them and force them to do something because Washington tells them to do it, even though it has no statistically significant effect upon enrollment. I think we just need to toss it out and do away with this myth that it does something. So I'll just say, I just keep on thinking about Washington forcing its will upon the American people, even when it doesn't have an effect. Oh my gosh, no wonder they're so mad at us. I'm sorry.
So this is probably not useful for this to turn into a debate, but, right? But insurance actuaries will disagree with you. Insurance actuaries will tell you that they are moving rates up right now because of the winnowing of enforcement around the individual mandate. And from the very beginning, plenty of insurance experts, people who know this business backwards and forwards, tell you that you cannot require that insurance companies price without any concern for the medical acuity of patients, without having incentives for healthy people to buy insurance as well. Now, I think there's a conversation to be had about how you incentivize healthy people to buy insurance, but I'll just guarantee you that if you maintain the ban on discrimination against pre-existing condition and you then get rid of the individual mandate, healthy people will stay outside of insurance because they will know that they won't have to pay any more if they just wait until they get sick. So I think there's conversation to be had about how you incentivize healthy people to get in, but I don't think the solution is nothing. And I listen to a lot of smart people who, Jonathan Gruber's a smart person, but there's a lot of other folks who disagree.
And I think this is a worthwhile discussion, if we may continue just for a bit. The woman who was the insurance commissioner for the Pennsylvania, who in finance, in Health Committee was kind of, very open to flexibility. And then when she testified in finance, she was all for the ACA. But she mentioned that she's not really sure. She's a Democrat, and she's all in for the ACA if you threaten it. She likes more money for Pennsylvania. If she said in the Health Committee, she wasn't sure the individual mandate made a difference. But she knew that if there's only one insurer in a county, and right now 50% of the counties in the United States have only one insurer, that she had no leverage on them to push down their rates, and they would say, oh, it doesn't really matter, until they wanted to increase their rates, and then they would say it did matter. She was suggesting a duplicitousness among insurance agents. Now, I would argue that Jonathan Gruber, doing research for the National Bureau of Economic Research, published in the New England Journal of Medicine, is a little bit more objective than your average insurance guy. I'll also say there are alternatives to the individual mandate. In Graham Cassidy, we leave open, and in Cassidy Collins, auto-enrollment, which works very well for CHIP, works very well for Medicare. In my state, for Medicaid, our governor who came in and wanted to expand enrolled 450,000 people in Medicaid in 18 months. Now, you don't have to have an individual mandate because that wasn't mandated. There's other solutions as opposed to Washington forcing its will upon the American family. No wonder they're so mad at us.
I think the problem is if we're back in this space, then we're not making any progress. I mean, CBO says that if you get rid of the individual mandate, there's an enormous fall off in the number of people who have insurance, and rates go up by 20%. So, and we can have this argument, but if we're having it, then we are nowhere. And so my hope is that we don't go back to the arguments that hung Congress up for the first 9 months. months and take the common ground that we found and act on it. And if the House doesn't like what the Senate did in a bipartisan way, then they should convene bipartisan talks themselves and come up with a different product. But if this is just going to be about Republicans saying my way or the highway, then ultimately I don't think we're going to get anywhere. And what I like about the Senate is that we decided to move on. We decided to close the chapter of partisanship and try to find bipartisanship. And if the Senate way isn't the best way forward for the House, then I hope the House tries to find a bipartisan package.
Well, let's talk a little more about the issue of competition that you mentioned, Senator Cassidy, and encouraging insurers to enter the marketplaces and the issues of premiums as well. Senator Murphy, in your own state of Connecticut, there have been some pretty steep premium hikes proposed by the insurers there. Do you think that it's enough to fund the CSRs, or what else? What other reforms do you think need to be made to the marketplaces to make them a more hospitable place for consumers?
Well, listen, I support the reforms that we have included in Alexander Murray. I've long thought that we should be making it easier for states to innovate. We've seen some really interesting reinsurance programs being used by states through no additional cost to U.S. taxpayers that have dramatically lowered rates. That happened in Alaska. Why not give states a little bit more ability to set up those reinsurance programs? A fourth option on the exchanges, something that certainly makes sense. But when you ask Connecticut insurance companies what contributed to their big rate increases this year, they will tell you the lack of certainty on CSR payments and the attack on the individual mandate. 30% of the rate increase in Connecticut is due simply to the CSR payments being pulled. So I think if we have an administration that is actually dedicated to implementing the Affordable Care Act rather than destroying it, and we do some work to try to give states a little bit more flexibility on these exchanges, there's a lot of good things there.
So I'll also point out, though, that the premiums over the first 4 years of the exchanges increased anywhere from 100 to 300%. In some places, it would increase 100% in 1 year. And that's when there were cost-sharing reduction payments. I think it's inherent in kind of the way those exchanges are set up. Relatively small risk pool, works very well in an urban area, but not so well elsewhere, that you're going to have problems with it. On the other hand, I am all for that flexibility. Alaska, if no one has noticed, is bigger than Rhode Island. Why shouldn't we give Alaskans flexibility to come up with a plan that works for them as opposed to Rhode Island? By the way, Chris just endorsed it, so I'm sure he's going to be a co-sponsor of Graham Cassidy, because that's what Graham Cassidy did. It took the money that a state would otherwise receive, including that amount allocated for CSR payments, and allowed the state to come up with a solution that worked for that state. They could continue the Affordable Care Act. They could continue the Medicaid expansion. Or, if it wasn't working for them, they could do something different. Doing those solutions that Chris alluded to that seem to be working really well in places like Alaska.
Senator, while we're talking about waivers, I wanted to ask you about the news out of Iowa this week that it withdrew its 1332 waiver request and it hadn't been approved by the Trump administration. Is that something that you think could have been approved, should have been improved? Is that within the capabilities outlined in the Affordable Care Act, or something that would need to be done through legislation?
You know, I don't know the details of that 1332, so I'll just speak in concept as opposed to the particular. But I'm all about increased flexibility, and frankly would like to have more combined 1115 waivers, Medicaid if you will, plus 1332, which would be the exchanges. Inherent in the exchanges is that the number of people in the risk pool is so small that you're trying to spread the risk of the older and sicker over a very small population. So you enter a cycle where only the older and sicker will pay the higher rates, and that becomes your death spiral. If you had a combined 1115, 1332, then you could combine the risk pool of Medicaid expansion with the risk pool of the individual market, and you combining those two bring stability, lowering premiums, which does increase enrollment. Statistically, unlike the individual mandate, lower premiums does increase enrollment. By combining those risk pools, you get there. And that was Graham Cassidy, effectively a combined 1115, 1332 waiver.
Senator, we all followed as the drama sort of played out last month around your bill, which people had dismissed initially and then seemed to have some momentum behind it. But at this point, do you have any realistic hope that Congress can return to that with the current makeup of the Senate?
Of course. Why? Because premiums are going up 40%. states are unable to pay their portion of Medicaid match. And Medicaid continues to gobble up state budgets. And that family sitting around the table gets tired of Washington telling them what to do, as they cannot afford higher premiums. So events will drive it. Hopefully by that time folks will be less threatened by it. Change is threatening, but they'll be less threatened, and recognizing that we are committed to all Americans having access to insurance and states having the flexibility to do it in a way which works for that state.
I think if Republicans learned anything during this debate, it was that it's really hard to propose something that would cut future Medicaid spending, because you get a lot of pushback on that. It pulled, as you know, many of the GOP bills didn't pull very well. But Senator Murphy, I wanted to ask you, there is a reality still that Medicaid costs are growing faster than state tax revenues. The Moody's report in May said that if laws are unchanged, state Medicaid expenditures will comprise 28% of their tax revenues this year. Do you think Democrats should be more concerned about Medicaid's fiscal challenge to the states?
Well, listen, I think there's plenty of room for Republicans and Democrats to work together on trying to address a healthcare system writ large that costs twice as much per capita than any other industrialized country, getting middling results. The fact of the matter is there has been nothing in any of the Republican plans that have been offered that truly attacks the issue of cost.
Of course, that's not true.
The issue of price, right? The issue of price being passed down to consumers by an increasingly for-profit healthcare system, whether it be drug companies, device companies, hospital companies, hospice companies. And within the Medicaid system, you are paying for all of that for-profit care. One of the important reforms in the Affordable Care Act was this transition from fee-for-service payments to outcomes-based reimbursement. President Trump appointed someone to head HHS who was the chief opponent of transferring our payment system away from volume-based to value-based. I'd like to see us, in a bipartisan way, get back on the train to try to transition the way in which we pay for health care. That could save us a lot of money in Medicaid as well. But the reason that these proposals have been so unpopular is that it's not just about flexibility. It's about a dramatic cut in the number of people who have access to insurance. Now, we never got to see the CBO score on Graham Cassidy because it was rushed through before we could get all the facts, but independent analyses suggested that it was going to look like the previous bills. And in Connecticut, we were going to get more flexibility, but we were probably going to lose 40% of our federal health care dollars coming into the state between the money we would lose in tax credits and the money we would lose in Medicaid. That is not flexibility that our state wants if we're going to get 40% less money to insure people, resulting in a humanitarian catastrophe as hundreds of thousands of people lose care. So again, I would hope that we would try to find the ground that both the Republicans and Democrats can agree on, rather than going back to debate something like Graham Cassidy or the skinny repeal or the Paul Ryan health care proposal that don't have any buy-in from a single Democrat in Congress.
So may I respond? Just about everything Chris said is wrong. And I say that particularly as pertains to those legislative vehicles that I put forward. First with Susan Collins, Cassidy Collins, and then with Graham Cassidy. Let's kind of work backwards. Connecticut wouldn't have lost 40%. It was only if you didn't read the CBO score, but you only read that which people said about the CBO score, which is taking small snippets without reading the whole thing. They said we cut Medicaid by $1 trillion. Well, what we did is, instead of funneling the money through Medicaid, we put it through a block grant. The state got as much money. They just didn't get it through Medicaid. They got it through the single block grant.
It's just not true, Bill.
I wrote the bill. Believe me, I wrote the bill. I wrote the bill. And so believe me, I wrote the bill. I know this. And so the fact, we preserve the taxes.
I read the bill. That doesn't make you more of an expert just because you're the person who wrote it.
I would kind of disagree with that. I say that because we didn't cut the only funding we cut was the was the individual mandate penalty and the employer mandate penalty. That was the only revenue that was cut, and maybe I think the medical device tax. And we actually, of course, would allow a state to reimpose those penalties should they wish. Connecticut didn't lose 40%. Connecticut lost a little bit because Connecticut is a very high-cost state. There was about 5 states in the nation that lost money under Graham Cassidy, 19 states that substantially improved. But those 5 states are incredibly high cost, at which point it becomes a philosophical argument. Should the federal taxpayer be obligated to support a high-cost state? By the way, Connecticut higher cost than Massachusetts or New York, so it wasn't just a regional thing. On the other hand, there are multiple things in the bills we put up that would lower cost. Price transparency. I now have a bill with that, I think with Senator Bennett, with whom we're putting that up. Price transparency. We also had provisions that would allow combining of risk pools that would, of course, lower costs by increasing certainty. We also allowed a provision in which individuals got their HSA pre-funded with health savings accounts, and then HSAs have been shown to lower cost into themselves because the so-called activated patient becomes a wiser consumer of healthcare, more discerning. I can go down, but there are multiple provisions that would. But ultimately, I'll also say, just go back to this, we didn't cut funding, except insofar as that we did away with the penalties. And as regards the 32 million people that were uninsured from the outside source, that was Avalier, which was a total hit piece. They scored us over 11 years and 20. We only wrote the bill for 10. So, of course, they said in the 11th year, everybody lost their coverage. Now, that was absurd, but that's what you get when you pay for a result.
So I want to kind of move on to ask Senator Murphy also about his Medicare bill. You notably were not among the 15 or so Democrats who signed on to Bernie Sanders' Medicare for All bill, where the government would be the sole insurer, and instead you said you're going to offer a Medicare buy-in system. Can you kind of explain that a little bit, and then why do you think your approach would be better than Sanders' approach?
Well, listen, I think we have to move on. I understand that Senator Cassidy is committed to this piece of legislation, but nobody wanted it. Nobody in the American public wanted this because they knew that in the end it was going to result in massive diminutions of coverage. And CBO would have said that. CBO would have said that 20 to 30 million people would have lost coverage. And the reason that the Republicans rushed this bill through is because they knew that CBO was going to say that this would have been a massive fall off of coverage all across the country. And they knew that it was going to say that Connecticut would lose money, shifting our tax credits to other states, and over time, cutting the rate of growth of Medicaid to the point that we would have to shed people off of our plans. So I do think it's important to start having a different conversation. What I'm suggesting here is that everybody should have the chance to buy into Medicare, which is the most popular insurance product in the country. Senator Sanders has a different idea. He says that over time we should outlaw private insurance and require that people take up Medicare. I understand the argument that we might in the end be better off if everybody was on one system of payment, but why not let people make the choice themselves? Why not let the market determine whether folks want to be on private insurance or whether they want to be on public insurance? I kind of think that if Medicare prices out where I think it'll be, over time, people will make that choice. They will choose to be on a Medicare benefit. But politically, it's a lot easier if you let people make that choice rather than forcing that choice upon them. But, you know, I live in a state in which we've had a massive consolidation of both insurers and providers. The current foundation of our system right now just fundamentally doesn't work because there is not enough competition either on the payment side or on the provider side. And we have to start admitting that, that we may have to, instead of just continuing to patch an existing system of provision, make some big radical changes. Single payer certainly is a big radical change, but you can test the theory behind single payer by giving everybody access to the Medicare benefit.
Medicare for all will be Medicare for none. And if you're on Medicare now and this plan is put into place, a system which is scheduled to go bankrupt in 17 years will go bankrupt in something like 10. Why do I say that? Because the only people that will initially opt for Medicare will be those who are older and sicker. Now, I suspect, I'm fairly sure I'm right on this, that Chris would not want those premiums to be risk adjusted for someone's health status. Rather, they would say if you have dialysis and you're $70,000 a year, you would not pay $70,000 a year, you would pay whatever someone your age pays. So you're going to do what is happening with the exchanges. You would concentrate the older and sicker on Medicare. But Medicare is going bankrupt in 17 years. Now, that is not me, that is the CMS actuaries who are running it. With its current obligation, with 10,000 baby boomers a day becoming eligible for Medicare benefits. So I think, although it's great in concept, great in kind of top line, maybe a bumper sticker, if you just think about how the actuaries would approach this, it wouldn't work.
Yeah, I think it's interesting because you would not get rid of the requirement that private insurers cover people without regard to medical acuity. So there's not necessarily a reason why people would move from private insurance over to Medicare unless the benefit, right, in the Medicare program was substantially better than the benefit in the private insurance plans. And yet you would still have the requirement for minimum health care benefits. Medicare's benefit actually right now in some ways is weaker than the benefit that's provided in private insurance. I think I think Bill's raising very good questions about how this would play out, right? You don't want to build a system in which you would push off the sick or the very expensive into Medicare. And all of those questions could be answered in a legislative debate. I just think it's time to start thinking and talking about some bigger ideas.
That's why he's going to be a co-sponsor of Graham Cassidy.
Let's try to create a few more good vibes on this stage by discussing something else you two have worked on together, and that is your mental health legislation. Elements of your measure were included in the 21st Century Cures Act last December. How did you initially decide to team up on this?
Chris was great. I'll just tell you that I had worked with Tim Murphy on the House side, and Chris approached me and just said, can we work on this together? And we didn't know each other that well, but our staffs worked together fantastic. And I just want to hats off to my colleague and to Tim, who's had some unfortunate events. We got something really significant through. And it shows that we can work on a bipartisan basis. And again, I thank my colleague.
Yeah, listen, it's funny. It may not seem like this, but Bill and I are very good friends, and our families are, and our families are friends, and we became friends.
He's going to take care of my poodle for a little bit, for 2 weeks.
and we have big disagreements on some of these big top line issues with respect to how you work the American healthcare system, but that hasn't stopped us from finding the places where we agree. And the fact of the matter is, we have left millions of Americans behind who have mental illness and addiction by, building a system that just doesn't meet their needs. And so we put together a big piece of legislation, the most comprehensive rewrite of the nation's mental health laws in a long time, requiring insurance companies to cover more of this stuff, putting more emphasis on both prevention and on crisis intervention by setting up a new assistant secretary position that for the first time will be in the Secretary's office with a voice on addiction and on mental health. While we still haven't implemented all the pieces of our legislation nor funded it, we're pretty proud to have gotten a lot of Republican and Democratic support. And it's a reminder that if you can set aside some of the most politically explosive issues on healthcare, you can still find agreement.
I'll also say it gave a paradigm, because I've approached, again, Democratic colleagues on committees and say, listen, what about drug cost? Chris and I combined on mental health, and we said, okay, there's some things that we can't agree upon, but a whole lot we can. If we can focus there, maybe we can do something. And so we're working on drug costs, for example. What can we agree upon in this space? We can absolutely get stuff done together.
One thing I'm struck by as being a health reporter is how the end goals are often very much the same, of getting people good coverage that's affordable for them, and yet the divide, as we've seen, appears so wide often between Republicans and Democrats. If you could each get the other party to accept one health policy idea of yours, what would it be? Just one.
And you can't say Graham Cassidy.
I would say that it's the individual who should have the power over her decision making. And it shouldn't be the federal government, a bureaucrat in Washington, D.C. telling her what to do. She's sitting at her dinner table. She has to balance the concerns in her life. We absolutely have to have coverage. But as a physician working in a charity hospital system, I learned if the patient, if the family has the power, the system lines up to serve her. We should give her the power.
I think that our system is stronger and cheaper if everyone has coverage. And if you don't have a federal strategy to make sure that everyone has access to preventative care, then you're losing. And that our goal in any healthcare reform proposal that we undertake should be to have more people have coverage rather than less people. I think that would be a premise that would be very important for both parties to hold.
And by the way, I agree totally with that.
All right, well, that's all the time we have for today. I'd like to thank Senators Cassidy and Murphy for joining us. And now I'd like to welcome back the Post's Chris Carlotti back to the stage.
Thank you. Thank you.